Good afternoon, everyone. It's Wednesday, March 18th. I'm Dr. Adam London from the Kent County Health Department. I'd like to give you an update today on the COVID-19 situation. We recently learned from the governor's office, actually from the chief medical executive from the state of Michigan, that we now have 110 positive cases of COVID-19 across the state of Michigan. At least 2 of these additional cases are residents of Kent County. We are still receiving this information as I speak, so stay tuned for more information as details develop. Unfortunately, we also heard news today of the first death in the state of Michigan, a man in his 50s with underlying health conditions in the Detroit area. Our heart goes out to his family. This is not surprising news that we would start to see deaths. It's also not surprising news to see such a huge increase in the number of positive cases today. Yesterday, I was telling you about 65 cases in the state, and today we've jumped to 110. Now, I want to make sure that you understand that that's probably not a true indicator of the increase in actual cases. I think what it really suggests is that the amount of tests, the number of tests, has increased pretty dramatically in the past few days. So, as we've been talking about for some time, I believe that the actual number of cases is much higher than what we're hearing, much higher than the positive test results, just because testing has been so limited. And on that note, we've had some questions from some of you about drive-through testing, and why aren't we doing more of that in Kent County? Well, to be honest, I would love to do more drive-through testing here in Kent County, and so would many of our healthcare partners. The challenge that we've all been faced with is that we don't have enough test kits, we don't have enough viral sample tubes, and we don't have enough medical safety supplies to do all of the testing. Together, Kent County, along with our healthcare partners, we're all leaning in, sharing what we do have to stand up testing opportunities where we can. And we are working very hard to find additional opportunities. The county has some things that we can offer. We have staff. We also have a number of great physical locations, and our facilities management team has done a great job of identifying the physical resources, tents, and other materials that could be used to set those testing locations up. We're really trying right now to have plans that are trigger ready. So as soon as test kits and medical safety supplies become available, we can pull those triggers and get some additional testing locations established in quick time. We've also had great conversations today with the good folks at the Rapid. I know many of you have had concerns about public transit. We've heard that some people would like to see public transit stopped. I think that would be a mistake. It would be a mistake because there are some people that rely on public transportation to access groceries and other essential needs. We do, however, need to be very careful that we're spacing properly and we're disinfecting properly in those buses. The Rapid fully understands that, and they've been fully supportive of that. They have a plan in place to make sure that people are spaced at least 6 feet apart, and that their staff has all the supplies they need to disinfect on an ongoing basis. Also want to remind everyone, call 211 if you need help, either with rent or utility assistance, if you're looking for food assistance. Also, I'm encouraging you, if you have the availability to volunteer. A lot of these food pantries are really looking for volunteers right now. You can be of great assistance to them. Call 211 and they can align you with a nonprofit organization that'll be a good fit for you. And for those of you who have the opportunity to donate financially, please, 211 is the site for that as well. These nonprofit organizations, these food pantries, are really going to be stressed in the coming weeks. Any donation, regardless of how large or small, is very welcome at this time. And finally, I want to let you know that many of our Kent County departments have scaled back, and we're trying, like everyone else, to get our staff away from crowds, to try to avoid mass gatherings, and so we're trying to make sure that our office environments are safe. So if you need to visit any of our Kent County offices, please call ahead and set up an appointment to receive the services that you need. You can find those phone numbers at accesskent.com and look there and you'll find all of the information you need to access the many great departments that we have here in Kent County. I'm Dr. Adam London with the Kent County Health Department. Again, I encourage you, please like and share these Facebook updates. It's very important. We appreciate all of you who have shared these Facebook updates. It's a unique opportunity for us to speak directly to our community without having to rely on others to carry our message for us. So thank you very much, and I'll talk to you tomorrow.